Hello and welcome to this public webinar updating on activity in Dorset related to COVID. My name is Matt Prosser, I'm Chief Executive of Dorset Council, and I'm joined today by the Director of Public Health Dorset, Sam Crowe, who works for both Dorset Council and for Bournemouth, Christchurch and Poole Council. And we were to be joined by the Assistant Chief Constable for Dorset, Sam Dorea. However, I've just been informed that the ACC has been involved in an incident and as a result is not able to join us, but I will try and cover her issues when we get to those questions. Can I start by thanking Dorset residents for how they've responded to this global pandemic, which, whilst thankfully having a lower direct impact on us here in the southwest, has nevertheless taken several hundred of our loved ones from us here in Dorset, and we should never forget that. In addition, it has and will continue to have a wider impact on our economy, our education sectors, and just day to day how we go about our lives here in Dorset. As I said, while we have low rates of transmission, we must not get complacent. It's our collective focus that is helping us keep these transmission rates down. As we're seeing around the country, as soon as transmission rates start to rise in groups who can perhaps potentially suffer less from COVID, it's not long before those transmission rates jump across to those at higher risk, some of our older people and those with underlying health conditions. But this focus on COVID is not just about COVID. It is about the wider protection of our education system, allowing schools to remain open for all, the protection of our economy, allowing as much as possible to trade and to remain open, and finally to our hospitals, allowing them to have the capacity to carry out other surgery and diagnosis of illness and disease, as well as support those people who are suffering from COVID. If COVID cases continue to rise, it will negatively impact on all aspects of our lives. So I'm going to hand over now to Sam Crowe to give us a public health update. I will then give you a short Dorset Council update before we answer some of the many questions that have been submitted to us. Can I invite our Director of Public Health, Sam Crowe, to give an update? Thanks, Sam.
Thank you very much, Matt, and good evening, everybody. First, I must apologise. I can't come on camera this evening because of an issue with my Microsoft Teams, but I am joining, obviously, to give you this update by audio. So I think what I'd like to say is I'd just like to echo Matt's opening comments there, that we've been really lucky in Dorset to have lower infection rates overall compared with many other areas in the country. But we did see a steep rise in cases in early October, similar to many other areas of the southwest. It's probably a combination of the colder weather, higher infection rates in some of our neighbouring areas, the return of schools and colleges, but that's only part of the picture. I know that there's been a lot of publicity around the return of students to higher education settings, and we've seen a consequent rise in the infection rates in the 18 to 30 age group. But we're also still seeing cases coming through in a diversity of settings. So we're seeing continued positive cases affecting schools, continued positive cases affecting our care homes. We're also seeing a number of workplaces increasingly affected by COVID. And in the last week or so, we've had more and more reports of COVID affecting GP surgeries, affecting our community hospitals, and also we've had at least one outbreak in a ward in one of our hospitals. Because of this increased prevalence of COVID, and you can see here on this chart that huge increase in cases across the two council areas over the past 7-day period, we changed our messaging deliberately under our outbreak management plan to issue a sort of amber warning, as it were, asking people to act to avoid a further spike in cases and to do all we can to avoid having additional measures imposed on us. So I'm sure all of you have seen the national coverage of the new 3-tier framework and all of the debates that have been raging over moving to different alert levels, particularly for the areas in the north that are suffering much higher infection rates. But for now, Dorset Council remains at Tier 1, a medium risk area. I'm glad to say that after seeing that steep rise in the first 2 weeks of October, it does look as if infections are starting to settle down. We're currently at around 64 cases per 100,000 population in the Dorset Council area, and that's over the most recent 7-day period that we take cases from. That amounts to about 20 or so positive cases of COVID per day. It's below the current rate for Southwest England, which is at around 84 cases per 100,000 population, and it's also below the rate for England as a whole, which is currently at almost 170 cases per 100,000 population. So we're in a reasonable place, but it's important that we're not complacent. And one of the things that I and the public health team are very, very vigilant for is not just the increase in cases, but what's happening to the infection rates in different age bands. So as Matt said in his opening address, it's really important that we try to do all we can to prevent the spread of infection into older age groups. What we know from looking at the pattern of transmission in other areas of England that are a little bit further ahead in this current increase in infections is that the infection rate rose very, very rapidly in younger age groups, 18 to 30-year-olds, but quite quickly you saw increasing infection rates in the 45 to 65-year-olds and the over 65 age groups. And when that happens, unfortunately, that's when you can have more serious disease with subsequent increases in hospital admissions, and sad to say also occasionally leading to deaths. And of course we need to do everything we can to prevent that from happening. So the current situation in the Dorset system in terms of our hospitals is that there are about 44 people currently in a hospital bed with COVID-19, and that's gone up quite a lot over the past couple of weeks. So we were in a pattern over the summer of seeing relatively few hospital admissions, if any at all, through the summer period. But in the recent weeks, we have obviously seen those admissions rise. In terms of what's causing the transmission, our main pattern in the Dorset Council area is still transmission within households. It's by far the biggest cause of, when we look at the likely exposure, if you like, to COVID-19. Someone's brought it into the household, probably because they've been exposed outside of that household, but we see subsequent positive cases from other family members. We're also seeing, as I said before, lots and lots of incidents in workplaces where we know that people are adhering as much as possible to the guidance around keeping 2 meters distance, covering their faces in enclosed spaces, washing their hands, but perhaps some lapses in behaviour when people are clocking off, perhaps at the end of the day, catching up with work colleagues and being less cautious about those measures, and transmission definitely taking place between employees when perhaps they're not as vigilant. We're still seeing lots of care home staff testing positive, which is actually a good thing because that's off the back of the regular testing that's going into our care homes. So unlike earlier in the pandemic, where we didn't have testing at such scale, we now have regular, repeated and routine testing of staff working in care homes, and that helps us to protect the residents by acting quickly to make sure that those staff are isolating, making sure we've got support for infection prevention and control going into the home, and as I said, protecting the residents from testing positive and contracting COVID. So overall, the response to these incidents and outbreaks in Dorset has been really impressive. There's been a huge amount of collaboration between the local public health team, Dorset Council colleagues and frontline professionals working in those higher risk settings. But as I said, we're far from complacent, and the Health Protection Board meets regularly to review the situation as it develops. We need to ensure that we've got the right resources in place to support that response. At the moment, what we're focusing on is enhanced communications, targeting key groups that are facing those higher infection rates, through to improving our range of testing sites to increase accessibility for testing, especially for people who can't necessarily drive to access, for example, the regional testing sites in Poole. There's obviously a lot of anxiety going on about the very difficult decisions that are being taken to look at whether additional measures are required, where cases are rising quickly. Locally, I'd just like to assure people that we regularly discuss these issues and the need to be prepared should we have to start to have that conversation about the need to move to a higher alert level. Thanks, Matt. I'll leave it there.
Great stuff. Thank you very much indeed, Sam, for that update. Really comprehensive. So as Chief Executive of Dorset Council, I'd like to explain some of the main things the Council has been doing to support you, local residents and communities through the pandemic, directly and on behalf of the government through their schemes. We obviously administered the government scheme to support local businesses with funding during lockdown, and we paid out well over £108 million worth of funding to local businesses to support them through this difficult time. And we stand ready to do this again if the government needs us to. At the current time and the tier level that we're in, that's not an option. But should that change and we need to bring in support for local businesses, we're ready to do that. We supported people who were shielding, and we called this our community shield effort, and working with our fabulous local volunteer and community sector, helping to distribute food parcels and medicines to those who are having to shield. And that support is still available for people who have health conditions, which means that they are at greater risk if they catch COVID. We work really closely with our schools across Dorset. We supported them with reopening in September for all pupils. Of course, schools were open throughout the period from March through to September for key worker children. And we're working really closely to manage any COVID cases that may transpire in our schools, whether that's in pupils or in our teachers. We work really closely with our care homes to help them manage infection control so their elderly residents stay safe, and we provided emergency PPE when they were unable to source this, PPE, personal protective equipment. And more recently, we've started doing welfare calls for people who are self-isolating, either because they've got a positive test result or because they've been told to self-isolate by NHS Test and Trace. This is just a flavour of some of the work we've been doing through COVID, while also providing our usual council services like recycling and waste collections, housing services, revenues and benefits support, licensing, planning, social care, trading standards, food safety. I could go on. But now I'd like to move on to some of the many questions that you've submitted. Firstly, can I say thank you? We've received hundreds of questions and we've grouped those into questions and themes so that we can answer them here, perhaps more succinctly tonight. So if I can move on to the questions. So face coverings, do they work and are they really effective? And the secondary part of that question was, why have you decided to implement face coverings in schools and on school transport? So Sam, can I ask you to start with answering the first part of that question?
Sure, thank you, Matt. So I think the first thing to say about face coverings is that we're talking about simple cloth face masks here and paper coverings, not the higher grade surgical masks or respirators used in clinical settings. And there's obviously been a lot of debate when this country was thinking or considering about use of face coverings. There was considerable debate about the effectiveness of them. I've had a look through the evidence base, and there's quite a helpful review that was conducted by a team in Oxford that essentially looked at a number of trials that have been done in previous pandemics to look at these type of face coverings. So these are face coverings used by the ordinary population. And the question they looked at was, is there any evidence that shows that they can prevent or reduce transmission of respiratory viruses? And I think the best evidence comes from experience during the first severe acute respiratory virus outbreak, which was in the 2000s. And a number of trials that review cites show clear evidence that if they're worn properly, they are effective in reducing transmission of respiratory droplets and therefore the virus. And because we're dealing with a very similar severe acute respiratory virus, this is effectively the SARS-2 coronavirus, I think that's the best source of evidence that I've seen. It does have to be said that they've got to be seen as part of a wider package of policy measures though. So that includes hand hygiene. There's no point in using a face covering if you've got dirty hands and you're taking it on and off and potentially contaminating yourself. And also social distancing. Everything that we can do to reduce the chance of respiratory droplet spread will be effective in reducing that transmission. So in short, wearing a mask made of tightly woven cotton material that fits properly over the face will reduce the spread of virus contained in respiratory droplets. So primarily, this is a way of protecting other people from the chance that you're actually carrying the virus yourself. And that's been measured quite clearly in those trials.
Thanks very much indeed, Sam. And then we've got the secondary part of the question, why have you decided to implement face coverings in schools and on school transport? Firstly, can I say this is obviously a decision made by individual schools and not Dorset Council. We've provided advice and guidance, but schools have the discretion to ask both parents and carers to wear face coverings if they feel it would support social distancing and safe measures at busy times like drop-off and collection. We've also asked, as Dorset Council, parents and carers to help their school by complying if asked, providing they're not exempt from wearing a face covering. Children at secondary and upper schools in Dorset have also been asked to wear face coverings on buses, again, unless they are exempt for a medical reason. The key thing, as Sam has said, is wearing them properly. Like any protection, if it's not put on correctly, it will not be effective. Going to move on to question number 2, theme number 2, which was a question which would have been taken by Sam Derea from Dorset Police. So how do people report flouting of the rules, and how are you approaching enforcement? So Dorset Police would say it is everyone's business to ensure they respect the government guidance and prevent the spread of COVID. Sadly, we know that perhaps not everybody does that. And the police here in Dorset have always and continue to adopt a 4 E's approach of encouragement, engagement, education, and then enforcement as a final option. But this can be used as and when required. Dorset Police want our communities to feel safe and protected, so they're working tirelessly with partners to reduce the risk of the pandemic. They have the ability to issue £200 fixed penalty notices, and they will issue those to those who refuse to change their behaviour. That's following that 4 E's approach. If you do see something that concerns you, consider whether it's a matter for the police or one of our partner agencies. The police continue to assess all calls in line with threat, risk, harm and vulnerability. And it's the vulnerable we will always seek to protect in the first instance. So just think about that when you're thinking of calling the police. Should somebody else be involved before the police? Dorset's COVID cases obviously remain thankfully low, and a big part of that is the way that communities have come together and respected the government and health guidance and played their part in making Dorset safe. We obviously don't want to be complacent, and the threat of COVID hasn't gone away, but our communities remain cohesive and strong, and Dorset Police will do what they can to support this. If I can move on now to question 3, which I'm going to ask Sam to answer. If we move to a higher tier, we're currently at tier 1, which is the lowest tier or medium, how would that work, and how is the decision made? Would it be pan Dorset or a separate situation for Dorset Council area versus the Bournemouth, Christchurch and Poole BCP area? Sam.
Thanks, Matt. So I think if I take you through this, the first thing to understand is that any decision would be made in discussion with government. And so our connection with government is through my discussions with the Regional Director of Public Health. And we meet regularly in the Southwest to look at cases and look at the local situation and start to have that discussion about whether we feel we're managing to contain our incidents or whether additional measures are needed. So it would be on the basis of a good understanding of whether additional measures would be likely to be effective given what we understand about our local situation. We have a health protection board which works across both Dorset Council and BCP Council area, and that board comes together and regularly reviews the data, and this is then discussed at that regional meeting where we have a bit of challenge around the effectiveness of the current actions we're taking under that board. If cases continue to rise, we would work with our local outbreak engagement board, which sits above the health protection board and involves our local leaders, our politicians, Chief Executive of Council, Director of Public Health and the Chief Officer of the CCG to agree whether moving to a higher tier would be necessary, understanding the pros and cons of this. And I think that through that board, it would be important that this is a considered decision and not something that's required or imposed at very, very short notice. So at least we've got a thorough understanding of the risks and the benefits from going into that higher tier level. Now, coming down to the question of whether it would be pan Dorset or a separate situation, I think if case rates were very different between the two council areas, it's possible you could see the two council areas being in different alert levels. But the impression I get is that increasingly government is looking for consistency, recognising that between BCP and Dorset Council, many people live in one area and travel to work in another. So what's caused confusion elsewhere in the country is where you have neighbouring councils under very different measures. And of course, it causes all sorts of conflicting advice and guidance. I suspect that if we were in a situation where we were seeing that type of rise in not just Dorset Council, but other councils in the Southwest, we may be looking at a regional discussion around moving to tier 2.
Thanks very much indeed, Sam. And you just commented on the CCG. Do you want to explain to those people who might not understand that acronym?
Yes, apologies. So the CCG is Dorset Clinical Commissioning Group. They're responsible for commissioning the providers of health services in the Dorset system. So our acute hospitals, our primary care services and community services.
Great stuff. Thanks very much. And I agree with you, Sam. It's a really difficult area, but there is a reality point, isn't there, that people do move around, and we need to be conscious of that. And the two local authorities are in constant communication around that. And of course, Sam's role is really critical to this as the Director of Public Health, because he covers both areas, which is really important. So our fourth question is, theme question is, can you stop visitors coming to the area? Can we lock Dorset down? The short answer to this is no. We can't prevent visitors coming to Dorset. What we can do is try to ensure those who do come to Dorset do so respectfully and safely. And remember that whilst they may be on holiday, they're not on holiday from restrictions, and they need to adopt appropriate behaviour, social distancing, hand washing, wearing face coverings, all of the things that we're doing in the local residences. We obviously ask any visitor to adopt that mindset of being aware and respecting those social distancing and the rule of 6 that is available here for us in Tier 1. And this must be respected so that we keep our rates manageable. So we welcome responsible and respectful tourists to support our local business and economy, which has clearly had a really turbulent year this year. Clearly, for the different tiers around the country, they've got advice and guidance around whether they should or shouldn't travel. And we're just expecting people to respect that. It is a really difficult position because we're not able to just say, no, you can't come in. Clearly, for us as an area, we're permeable. We have, as Sam has already said, people who live in Bournemouth, Christchurch and Poole and work in the Dorset Council area. We have people who will live over the borders in Wiltshire, in Hampshire, in Devon, who work in this area. And if we were to close down the borders, it might actually have a negative impact on our workforce as well as our wider economy. But if people do come to the area, Sam Derere, if she'd been here, would have said that we will take appropriate action, again with the 4 E's approach to changing and encouraging compliance. We will engage, we'll explain, we'll encourage, and as a final resort, we will enforce. I'm going to move on now to question number 5, and again, one for Sam as Director of Public Health. Why don't you show stats on hospital cases and deaths? Sam.
Thanks very much, Matt. So I think the first thing to say is that we began publishing our system briefing in public on the Public Health Dorset website on a regular basis because we realised that the public and stakeholders would probably want to know regular update about our position. And it's an interesting question. And from a public health point of view, we mainly focus on the cases and the infection rates per 100,000 population for surveillance purposes. So particularly looking at the most recent 7-day period, that's our quickest indicator of how the pandemic is affecting our local area. And it can also be used to compare what's happening in the Dorset Council area with neighbouring councils and also within the wider region. So we monitor a range of other indicators, including testing positivity rates, use of GP and NHS 111 services, particularly where COVID symptoms are mentioned. It's not just those sort of headline cases, if you like. So that's primarily why we publish that on our web pages rather than focusing on hospital admissions and deaths. But the data is available, and from today we have taken the step of starting to include that data on that system briefing update on a regular basis. It's also published regularly in the public domain, so you can find data on deaths in hospitals from the NHS England website, and also data on deaths in registered care homes from the Care Quality Commission. But I think in the early days, we took the step of perhaps respecting some of the sensitivity around that data, particularly where there's small numbers. And that's why we tended to go with the public health headline surveillance measures in the public domain rather than those data sets. But I'm reliably informed that from today, we will be including some of that information on our regular system briefing.
Great stuff. Thanks very much indeed, Sam. So we've got question 6 here. How will schools operate during an outbreak, and what's your approach to home learning? So we're working closely with schools to make sure, as far as possible, they stay open for all of our young people. It's the intention that our schools will be the last places to close, and that wherever possible, they would be, at very least, provide for vulnerable children and key worker families on site. But where closures are necessary, and sometimes they are, for either small groups of children or more widely, we expect schools to support children through home learning with a wide range of resources. We know that's a challenge for our teachers who've been working incredibly hard all year. They have been planning to be able to do this, and there is a government requirement that they make home learning available to those who are unable to attend. But clearly schools are complex places, and keeping them open demands really close working with the head teachers, council staff and public health colleagues. Each situation is different, and each school gets personalised advice on how to proceed when infections are identified, depending on what is happening. So as a council, we work closely, as I say, with Public Health Dorset and all schools to safely manage any coronavirus cases that occur. All schools, colleges and education settings are following Dorset Council, Department for Education and Public Health guidance. Risk assessments have been prepared and hygiene measures are in place at those school settings. Plans have also been prepared to make sure that when any incidents do happen, they're dealt with promptly and safely. If and when cases occur, then all close contacts of the confirmed cases are notified and advised to self-isolate for 14 days. Contacts of the confirmed cases should get tested if they go on to develop symptoms. Even if people test negative, they must still self-isolate for 14 days. And we advise the public of cases at schools after parents and carers have first been advised by their school via our website on the Dorset Council pages. That page also features the latest advice and a symptom checker. I'm sure there'll be a link towards our website and those pages at the end of this session. If I can move on to the final question now, which we've taken. Are you doing local test and trace? Is testing working? Are results coming back quickly enough? And I'm going to ask Sam to answer this.
Thank you, Matt. This is a really important question. And again, there's been lots of coverage in the media about the possibility of local public health teams taking on that local contact tracing effort. So the first thing to be clear about is that as a public health team, we've had lots of discussions with the regional health protection team run by Public Health England about this issue. And we've decided for now not to do local test and trace. That's because we work very, very closely with the regional health protection team to follow up on cases, particularly those connected with high risk settings like care homes and schools and workplaces. And that system's working really well. So the current completion rates in our area for following up on positive cases are in excess of 70%, and the completion rates for following up on the contacts of those cases is also around 70%. That also includes around 15% in both of those categories that are still going through the system. So potentially up to 85% where the test and trace system is able to get in touch with those people and to request them to self-isolate. The real issue is actually compliance with self-isolation. So from studies done elsewhere in England, there's a suggestion that perhaps up to 70 or 80% of people are not completely self-isolating for the whole of that 10 or 14 day period. And so for that reason, what we are doing, rather than duplicating the test and trace efforts, is to offer additional calls to people who've tested positive. So as soon as we get the data through about our positive cases, we work with customer services in Dorset Council to put in a welfare call just to check in with that person, check that they're okay, and ask if they've got any additional needs. Are they able to get support for getting food in? Do they have any need for getting hold of essential medicines, for example? That kind of welfare check-in is really welcomed by people who are self-isolating, and that's how we feel we can add value to the current service. It's really important that we don't duplicate or confuse what's going on through the national test and trace service and the way that they work with the regional health protection team. So for now, we aren't taking on local test and trace, but we are regularly having that discussion. If things change and we were required to start to do local contact tracing because we had more serious outbreaks, we are thinking about our contingency plans and who we could stand up very quickly should we need to do that.
Sam, thank you very much indeed. I hope that for those of you watching and listening have found this session helpful, but we would value your feedback from this, so there is an opportunity for you to give us feedback about that. Can I encourage you, if you're not already, to sign up for our weekly newsletters that go direct into your email inbox. But above all, everything else, please stay safe and stay well, and thank you very much for watching.